You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He's an expert on the topic, and his name is Dr. Dhaval Shah. Dr. Shah, welcome to the program.
Thanks for having me.
Now, you brought a stack of photos, before and after photos.
Yes, we have so many patients, we help them. So
Okay.
we have a lot of stories to share.
Now, we probably won't be able to get to all of them, but
Okay.
we'll get to as many as we can. Now, for people that don't know your practice, who's the typical dental implant patient that you see?
So people we see they mainly have the teeth, but they have like bleeding gums, loose teeth, and they are afraid they're going to end up having a dentures. And the second category, the people who already have a dentures, but they are not fitting it properly, and they cannot chew properly, cannot eat properly, but somehow they got used to over the times, but at this point, either it's broken or they are looking something new in their life.
So at your practice, I mean, your focus, in fact, we've talked off camera, about 70% of what you do is just dental implant dentistry.
Yes, that is correct. And sometimes we help the patient if we can save the teeth for them. But yes, the implant practice, that's what we do mainly.
Is that right? So the denture wear, now correct me if I'm wrong, I'll put you on the spot. A denture wear can come in on the day of the procedure with no teeth
Yes.
and walk out with upper and lower teeth, full arch of teeth that don't come out.
Yes,
Is that correct?
That is correct. That is correct. So many times people don't know the options. Many times they say dental implants, that is a year or 2 year long procedure, but not at our office. Like with all the modern technology we have, and we have our in-house lab, so we don't have to worry about sending the cases out somewhere else to make the teeth and everything. So
I mean, you told me you literally digitally print the teeth in the other room.
yes,
Is that right?
That is absolutely correct.
Okay.
So we do the surgery, and within 2 hours we can deliver the teeth which are supported by the implant and which don't come out.
How soon can they eat after it's done?
They can eat the same night, but we want to go easy, and before you know, they can start eating the corn and the corn and the cobs, apples, like chewy pizza and Caesar salad, like things they are missing since many years because of the bad teeth and the bad gums.
And so as far as maintenance, I mean, after it's all done, they just come in like regular checkups, like
Yeah.
regular teeth?
Yeah, that is right. Like if we see them every 6 months, they are the happy patient ever. Like they don't complain about the pain. They don't complain about the dentures moving, or they don't complain about they cannot eat certain food, and they have a great smile. So they are always a happy patient in the office.
Okay, good. Now, one more thing, and we're going to get into your photos. And correct me if I'm wrong too. People need to know I'm not siding with you. I'm just asking you the questions. But how dental implants are typically done is you go to one place that does a surgery, another place where they put the teeth on top, and then they get them maintained elsewhere. At your office, you do all three parts. Is that why you do it so quickly?
Yes, that is absolutely correct. So at our office, we do the surgery, we deliver the teeth, and we maintain at the same place. So it is one office, one doctor, one fees.
Okay.
What happens?
So is it less expensive that way?
Yeah, that is absolutely correct. It is a less expensive, one doctor, one fee.
Okay.
You are not paying at multiple places, and you are not going multiple places for the services. So you just come at one place to maintain your teeth.
Now, in Philadelphia, are there really a lot of people either wearing a denture or headed to a denture? I mean, is it a big problem there?
It is not only in Philadelphia. Yes, it is in Philadelphia, but according to the American Dental Association, there are more than 30 million people in the United States who are missing all the teeth. They are wearing dentures.
Okay.
So, and recently, the W Health Organization came as the edentulous people they consider as a physical disability because they cannot eat properly or cannot talk properly. So this is a big problem right now.
And, well, why aren't they all doing it? Like if it's so good, right, to get new teeth again supported by dental implants, why aren't they all doing it? What's your take on it?
Many times they don't know their options are. What happened that they are using the dentures, they don't go to the dentist more often, and when So, and when many offices, because they don't have expertise, the patients told that like they don't have enough bone to place an implant. So
Yeah, but it is true, isn't it? I mean, if you've been wearing a denture 20 years, you can't do this. You don't have enough bone. Is that right?
that is not right anymore. Like
Okay.
with the specialty implants now, like we engage the strongest part of the jawbone, and we can make them at like different angles and everything, and we can give you the very implant supported teeth which are locked in a place which don't come out. And another people and another thing, people thinks they are too old for it.
How old can you be to do this?
I have a patient like 86-year-old.
Okay.
So I have a patient came with the dentures, 86-year-old. He was in the denture, I think about like 15 or 16 years. And for him, we did the top and bottom implant supported fixed teeth, which don't come out, and he can eat whatever he wants.
So 86 is not too old.
No.
So
And
when the 70-year-olds ever say, Doc, am I too old?
I tell the patient, see, at our office, philosophy is everybody will live 100 years. So when 70-year-old patient asks me, am I too old? Is it worth to get into the dental implants? I tell them, you are 70-year-old, you have minimum 30 years to go, and you want to spend all this precious time not having a food you like, not eating a food you like, or not confidently smile, or you spend this 30 years like happily enjoying every moment of your life, eating all the food you want, and spending a time with your family and friends. You might want to go to your high school reunion, and
Do you hear these stories from patients?
Yeah, they avoid the friends and families, and many times the college reunions, because they are afraid that they will be judged by their friends not having a good teeth or having a dentures or something. The people who wear the dentures don't want anybody else to know that they are having a false teeth in their mouth, because that makes a big effect on the self-esteem.
Okay. Now you brought photos. Let's take a look at some of these photos. Now these are patients that have been through the dental implant process.
Yes,
that right?
That is right. So look at this patient. This is Anne Mary, very sweet lady.
Okay.
She has a lifelong problems with the missing a teeth. She has a partials, and she keep losing more teeth, and she getting like new partials. And she came to our office to check her option. Her option will be the top and lower dentures, but that's why she came to us to get the implant supported teeth which are locked in a place, and she can eat confidently. I have a picture after we're done with the treatment.
She looks happy about this.
Yes. So what we did for her is implant supported teeth, and look at the smile. Doesn't she looks like a different person?
It's true. Yes.
And she can eat everything. She don't have to worry about like taking the partials off, like the food is getting stuck under the partial. And she told me the story that like when she go out to eat, whilst eating, the food gets stuck under the partial. She has to excuse herself, go to the restroom and clean the partial and put back on. And she also watch what she can eat, what she cannot eat at the restaurant.
So now she just eats whatever she wants.
And I have another picture with after the treatment, she brought the apple, and she bite in the apple and showing off everyone in the office. And for the people who has a normal teeth, it is not a big thing, but she hasn't eaten the apple since last 20 years.
Okay.
She bite on the apple, she feel its juice coming from that bite, and that she was dreaming about since last 20 years.
It's very nice.
And let me show you the profile picture. Like this is the before, and this is the after. Like how makes the difference. Everybody's asking her if she got the facelift surgery or any cosmetic surgery. No, she just got the teeth which are staying in a place. That's all she got it done.
So it kind of supports the facial structures.
Yes, that is right.
And now we should mention everybody's numbed up, right?
Yes.
Sedation. They're getting some sort of sedation.
Yes.
And is this true that they almost have very little memory of the procedure?
Yes, that is right.
They just kind of at home come out of it and they go, I got new teeth.
They got the new teeth.
Yeah, and they have medications at home if needed
Yes, we
for
give them.
pain or things like that.
Yes, we give them proper medications, and most of the time, the next day, they are on the over-the-counter like pain medications. Here is another patient. Look at the teeth. What he has broken teeth since many years, and his fear was he will end up in the dentures. He been to a couple of places before, but they give them an option. His only option was the dentures. That's why he was not. He was just living with the broken teeth and very unattractive smile. We gave him a upper and lower full set of teeth, which is locked in a place, and look what happened.
Oh, wow.
Does he look more younger?
He does look younger.
Does
yes.
he look more handsome?
He's more handsome. That's right.
And when you smile,
Because that's just teeth, according to you. That's
Yes.
what they do.
Yes, and what happened when you smile, you are more approachable. You looks like more educated. You looks like more refined man.
Yeah, you could say that for sure.
So when you smile, let me tell you another things. When you smile, you create a positive loop. When you smile at someone, there is very likely is going to smile back to you, and you create a positive loop. So that's create a positive and a good environment and relaxed environment all around you.
Do they change? Like you give them a new smile. Do you see changes?
We see
Like when they come back for checkups and things like that?
we see a complete change many times. They are more happy, they are smiling more, and they start joking more, and they looks like a completely different personality. Looks like their life before the teeth and after the teeth. It's complete. Many times the patient describe that, like they have different life before and the different life after
right?
they got the teeth. Yes, I have another lady, like she's missing a lot of teeth, and the same story. She was given an option to get the, like,
I mean, is that common? That looks very unusual.
that is right, but you don't see that often because these people don't smile because they hide their smile.
So it's everywhere.
It's everywhere. It's there are a lot of people in our town near Philadelphia that I know that they are hiding something. As a dentist, when we go out anywhere, the first thing we see is the teeth. And if somebody is not smiling, we know they're hiding something.
Okay, so with her, again, she would have had a denture?
Yes,
Possibly?
yes, that was the option given to her.
Too young to be wearing a denture.
Yes, and then we did upper and lower fixed teeth, which
very nice.
The upper and lower teeth, which is locked in a place. Look specifically, she has a little space between the two teeth
Yeah,
in
the
the front.
space in the front.
Yes, so on the day of the surgery in the morning, she told me, "Doctor, can I request you something? When I had a good teeth, I have a little space between my teeth. I always have a dream about the smile. Can we do that?" Now, because we do everything in the house, we custom design the teeth. All the pictures I show it to you, you see they are fitting to their face perfectly.
So this way people don't even notice that she had anything done.
Yes.
God,
So
that's a great story.
So
She looks great.
Yeah. So I just talked to my technician and asked him, okay, this is the patient need, and we design the teeth, like custom design the teeth that way, and she's very happy. Like for her, is the dream comes true.
What's it like when they look at their teeth or their face in the mirror for the first time?
We see a lot of tears in the office. Like sometimes they choked up, like they cannot even talk for like 5 minutes. They just, and not only the patient, because we do the sedation, the person, like family member is coming to pick them up, they
get emotional too.
They get very emotional too.
Wow, okay.
And not only the patient and family, sometimes as a dentist and our team members get emotional too, because we know that their before story and how their life gonna be changed. So it is get very emotional many times.
Very nice, very nice. Time for a few more.
Okay, I have The Martin, he came with the pain. His main complaint was his teeth. He's in pain all the time. He cannot focus on the work, and he wanted to do something, but he did not want to get in the dentures because that he saw his grandmother in the dentures, and the denture was sitting always on the nightstand on the side, and she was not able to eat anything with those dentures. So because of that fear, he was avoiding the treatment. So we gave him a brand new set of teeth, upper and lower, which don't come out, and you won't believe it how good it looks. It's completely
wow. Yeah, I'd say so.
Look at his smile. Maybe he's not smiling big enough because he hadn't smiled since last 10 years. When he came to the office, his wife came with him. Wife told me, if he can smile again, it will be the best thing happens to us in our marriage life, because he was very self-conscious, and he was not even smiling in front of the wife. Imagine when you are not smiling, what kind of message you are sending to other person. The smile is a very powerful and important gesture. It is universal language to connect with other people. When you smile, create a positive environment, positive aura around you, and everything
This is good.
Everything fall in a place.
Do you ever look? You're on a consult, let's say, with a guy like this, right? And this particular guy, do you ever get excited, like in your brain, you're saying, "This is going to be good"? He has no idea. Does that ever go in your?
That happens all the time, because as a dentist, we do a lot of procedure. We can imagine what it's going to look like afterward.
So they don't know how good it's going to be.
Yes.
Is that right?
Yes, that is right. But it is help them to change their life completely. But I want you to look at the teeth after. Look how perfect smile it is.
It does fit his mouth perfectly.
Yeah.
That's all by design.
Yes. Without the technology and the digital dentistry we do, we won't able to deliver this result.
Would you say less than 5% of all dentists in America have that in-house lab setup that you have, where they're printing teeth and making teeth?
Yes, I would say less than 5%. Yes, that is an approximate right number.
Okay, good.
Because you need a lot of the training, you need a lot of skill, you have to invest in heavily, and it cannot be done by the one person. You need like the team members to do all these.
Okay.
So it takes time. We used to do an old way, like what everybody is doing right now, but after the technology, our patients are the one who is getting most of the benefit.
If they took away your machines that literally digitally print teeth, make teeth, would you be able to get these kind of results? I'm complimenting you on the teeth look really well. Great.
Maybe, but it will take me six months, not the same day.
Okay. Good. Another one. Let's take a look. Very nice.
Look at another picture, like the Steve one. Mm-hmm. When we asked him to smile, he said, I don't smile. We have literally tell him, okay, at least pull your cheek so we can take one picture of your smile, and look how he's smiling.
Okay.
We give...
looks like a tough guy in a way.
A very tough guy. Look at his personality. Like when you do not have a good smile or unattractive smile, you look like very tough. You looks like unapproachable. You are not a good guy to work with. After we give him a upper and lower full set of teeth.
Is he another one that dentures really were an option?
That is right. He was given only that options. That's why he was holding for this treatment to do anything since I think it's almost like 6 years.
So let's take a look at that after. Is that him?
You won't believe it. Like, look at the smile. Look at his eyes. Like
it does look good.
Does it looks like more approachable to you?
Yes.
Does it look like how handsome he is?
Yeah, he's definitely more handsome.
Yeah. And
so these guys are smiling all over town.
All over the town.
Showing off their teeth.
Yes. I have another patient. Let me tell you the story. After we gave him a upper and lower full set of teeth, 2 days after, from the Philadelphia, he drove all the way to the Miami, like 16, 17-hour drive to show off his teeth to his friends.
I told you, that's good.
Yeah, he got so excited, and then he just wanted to smile in front of the friends and just enjoy. So he did that.
Now we are short on time. Time for a couple more.
Okay, let me go over quickly then.
All right.
Like I have this sweet lady came with the missing a teeth on the one side. She was using a partials, and the option was given to have remove all the teeth and get the dentures. That's why she come to us like for the consultation. We give her implants and a set of teeth which don't come out.
Very nice.
Look at her eyes. Like it's completely looks like she's more joyful. Like she's scanning herself more more confidently. Let me go over
Very nice.
Let me go over with another picture. Like this person comes with the very loose teeth, bad gums. Look at his teeth. Like he has some dentistry done. Like he has done some crown work.
I have to interrupt for a second. But if you said he had bad gums. If you have bad gums, can you still get implants? Will they stay in there?
Yes, so you have a gum disease because of the bacterial infection. So what we clean all the bacterial infections, and then we clean up everything, and then it is not a reason not to have an implant.
So your typical patient does have bad gums.
Yes, that is right. Yes.
Okay.
They have the bad gums, bleeding gums, and that lead to them like a loose teeth, and they end up keep losing a teeth one by one, and then they are afraid they're gonna end up having a dentures. Look at the after picture.
Very nice.
The same thing. We did the full mouth reconstruction. He got a full set of teeth which don't come out, and he told us that he cannot eat a lot of food because he work at the pizza shop.
Pizza shop. Okay.
The pizza shop, but he cannot. He cannot eat his own made pizza because of the loose teeth. Now there is no restriction.
So now he can eat chewy things or whatever.
Yes, that is correct.
Can I ask you a question? I'll put you on the spot. If somebody's watching this right now, they have no teeth or really bad teeth, they have to be removed. If you had an opening on your schedule, the day after tomorrow, or in 3 days from now, they could have their brand new upper and lower set of teeth.
Yes,
is that true?
That is right. We can
really.
It can be done as quickly as in one day. If you have an opening, you are absolutely right. And many times we have done that way. You come in the Monday morning for the consultation, and the Tuesday morning we do the surgery, and by end of the Tuesday you have your teeth which don't come out, which lock in place.
That is hard to believe.
Yes,
really,
it's absolutely right because of all the technology.
Because you have an in-house, you're making the teeth.
Next room, and what we do is we have a little glass door over there. When we print the teeth, patients are looking at all the machines, like what's happening,
making a teeth.
Let me show you another patient. Like she has uneven teeth. She don't like her smile, and actually she has some a partial denture since 20 years, and she was not able to eat the food she wanted to eat. Look at the after picture.
Oh, yeah.
Look at the
big difference.
Look at how the personality changed. Now,
yeah.
She's a very sweet person. She
looks younger too.
Yes, and she's a very sweet person. Now her smile matches with her personality. So let's make a big difference.
Okay, we're almost completely out of time. Probably 2 minutes left. Insurance. I guess Medicare doesn't cover this. Medicaid doesn't cover this. Even the best dental insurance really doesn't cover this. So what are you doing to help them?
But there is a great news. We can finance them.
Okay.
And most of the people, not at our office only, but all the places, they can finance that. They can stretch out the payments for 7, 10, 15 years, and we make them affordable.
So about 80% of the people are financing it.
Yes, that is right.
So they have to have okay credit a little bit, right?
Yes,
so it's
that
not
is
like
right.
you're carrying it, but they're financing it.
Yes, that is right.
Good. So no more dentures? We said that at the beginning of the show. No more traditional dentures. Do you believe that's the future of dentistry?
It is a present. It is a present. It is here. I would say like very few dentists are doing the treatment this way, like a same day teeth, but like more and more the dentists will train on it, like they will adapt on it, and then and ultimately the patients who are getting a benefit from this one, they don't have to deal with the loose dentures, they don't have to hide their smile, or they don't have to excuse themselves when they are eating and then something is falling out.
Tell me this, if you're, because you do 87-year-olds, 86, if you're plus 80 years old, 75 plus, you're on 4 or 5 medications statistically. Can you do this if you're on a blood thinner? Can you do this if you're on osteoporosis medications? Can you do it?
Yes,
still?
absolutely right. Let me tell you one thing. As long as you are healthy enough to come out from your car and walk in the office, there is a very good possibility
that you can do it.
Like we can do it. Yes.
And you may have to work with their medical doctor.
Yes,
or talk to them if you have to.
Yes, that is correct. We talk to them, we take the medical clearance, and we change the medication as the recommendation, and we can do the treatment.
Now in fact, you told me in the green room. I mean, I'm paraphrasing you, but you consider yourselves Philadelphia's like premier center for implant dentistry.
Yes.
Is that right?
That is right.
Is that your goal?
That is a goal, and our goal is to not to be a just premier center in the Philadelphia, but our goal is to help all the people in the Philadelphia.
Okay.
Like we, many times patients told us like we changed their lives, but that's not true.
You didn't change their lives.
They themselves changed their life. They took the decision that they want something to do for themselves. They pick up the call our office, and they make a consultation appointment, and that changed their life.
Is there a fee for the consultation?
No, it's absolutely free. That doesn't cost them anything.
Okay, so you'll meet with them. So we're completely out of time. But let's just suppose somebody's watching this. They have heard what you have to say. They have either a denture or they have teeth that are so bad they're worried they're going to end up in a denture. Let's say they've heard you, but they're skeptical. What do you say to them? They're afraid maybe.
I will tell them there is a hope. Like you don't have to end up in the dentures, and if you are afraid of the dentist, trust me, you are not alone. I will tell you, most of the people I saw it today, they have put it off for like maybe 5 or 10 years, and they are regretting so badly. So I will invite you all, just come in for the consultation.
At least get a consult. Know your options.
At least get a consult. Yes, you get.
And you have
get
payment
options.
plans where you can talk to them about.
Yes, that is absolutely right.
Okay, Dr. Shah, I want to thank you for coming on the show. Great stuff. And do they make an appointment on your website or just call your office?
They can do both way. They can call the office. They can they can book appointment online on our website. Whatever makes comfortable.
Okay, good. Thanks again. Good stuff.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.